Because of more hospitalizations and staffing issues, several local hospitals have had at times to tell ambulances to take patients to other emergency rooms. It's called diversion. While it's a last resort move, Rochester General Hospital has already had 2 diversions this week. Ellie Peters joins us now in the newsroom with how we got here and who's stepping in to help. Ellie.
Yeah, Adam, it's not a situation our local hospital systems want to be in, nor is it that common. In fact, Rochester General Hospital says it's been close to 15 years since they've had to divert patients. But last night and on Sunday, for 4 hours at a time, they've had to send people elsewhere, giving emergency departments the time to catch up with care. At Rochester Regional Health, hospitalizations are on the rise as Omicron spreads.
We were running around 195 to 200 patients in the hospitals in aggregate for the last week or so, and now we're up to 245. More
cases result in overwhelmed emergency departments as more and more people come in and more staff call out. At RRH, Dr. Mayo says hundreds of staff are out every day due to illness.
Patients do sit in chairs in hallways. They are on stretchers in hallways. No one likes that. It's uncomfortable for the patients. They don't feel well.
Because of the stress, hospitals have been left diverting patients due to a lack of bed space. Twice this week, Rochester General Hospital has had to do just that, and Monroe Ambulance has stepped in to help.
In my experience, this is only the second time it's happened, but it's happened twice in 5 days, 6 days. That is very, very unusual.
But John Caulfield says while they're there to help, EMS crews are also facing their own staffing issues, which is why FEMA sent in 2 ambulances last night to help.
The long-term fear of this is that as hospitals go on diversion, it increases demand and challenges on the other hospitals.
But despite the overwhelmed hospital systems, experts say if you're truly in an emergency, call 911.
I want people to understand, you call 911, somebody will come to assist you, and we'll get you to the right care as best as we possibly can.
Now, doctors ask that you don't go to the emergency departments for COVID tests. Instead, you should go if you have any of the following symptoms: chest pain or left arm pain, serious burns or cuts, seizures, severe allergic reactions, stroke symptoms like slurred speech, sudden numbness or facial droop, or multiple injuries or a possible broken bone. Live in the newsroom, Ellie Peters, News 8.
Ellie, thank you. Along with diversions, hospitals have also had to temporarily shut down some clinics to move staff elsewhere. Rochester Regional Health currently has 19 of its facilities temporarily closed across the region. This while URMC closed its Noyes Health Urgent Care in Geneseo this week.